Good evening and welcome to our show. I'm your host, Gurmeet Sodhi. Today to talk about something that we know the issues there, but yet we choose to ignore it. Call it the white elephant if you may in the room, but sometimes we just need to know what are our priorities in life. In South Asian community, in Asian community, usually family comes first, which is great. The party life, social life comes second, which is great. We all need a little bit of that. And then, of course, then comes work and business and everything else with it. But the health aspect of it, taking care of yourself, usually is on the bottom of the list, or it doesn't even make it to the list. And that is something we need to talk about to address issues, how we can take steps to live a better lifestyle, to make better choices, and try to see how we can take preventative measures. Today is World Hypertension Awareness Day. And with that, we have two great guests with us in our studios who are going to tell you what kind of wise choices you can make and how they can help you get involved in taking care of yourself. With that, I want to introduce Dr. Nadia Islam, who's the assistant professor at NYU Langone Medical Center. Welcome, Nadia.
Thank you for having me.
And we also have Rucha Kaur, who's the assistant director at United Sikhs. Welcome, Rucha. It's a pleasure having you.
Thank you so much.
So you know what? One thing I know, all of us being from the Asian descent, we know that growing up also, going to the doctor wasn't something that, a regular checkups is not something that's a priority. When you get sick, you need to go to a doctor. But other than that, it's not something we think about all the time. So when you guys are doing different programs, we started this program, Reach Far. You guys started the program, Reach Far. But before we even go into Reach Far, tell me, what is your outtake when you look at the Asian community in preventative medical steps? What do you guys see out there? I'll let you start, Nadia.
Sure. Well, I'm a researcher, so I approach this from a research perspective. At NYU, we have a center that looks at health issues among immigrant and minority communities. And what we've been able to see in Asian American communities is that in Asian communities, there are high rates of diabetes, higher rates of hypertension in some Asian communities compared to others. And yet very little attention is being paid to that. When we think about health disparities at the national and New York City level, oftentimes Asian American communities are left out of the conversation. Oh. And so we really started this program to bring awareness to the health issues that are affecting our community, and then to take it to the next step and think about ways that we can get out the message to the community and create health promotion programs that are meaningful and relevant to them.
Okay, so that's with your medical background, right?
Yeah.
So Rucha, I'll come to you now with the social aspect of it, because I know you're more hands-on and on-ground with the community. What do you see, especially in our Punjabi community?
So we've been working on community-based health programs for a while now. And a lot of our work has focused on cardiovascular disease prevention, such as diabetes and heart disease and so on. And one of the things that we see where we see that people are not talking a lot about prevention. So if you have diabetes, then you manage it, or if you get heart disease, then you manage it. But really the conversation around prevention doesn't happen as much as we definitely like to see. So a program like Reach Far really allows us to work with our Sangat members, our community members, allows us to work with Gurdwaras and with providers from our community to spread the message of awareness, to spread the message of prevention, and also for folks to get more engaged in their own health. At United Sikhs, our health programs focus on taking a proactive approach to health. So let's start thinking about, let's start knowing our numbers, let's start talking to our providers, let's take a look at our diet and our exercise, and let's take a proactive approach so that the conversation about prevention sort of becomes a norm for our community.
It's a good target to have, and I do want to wish you good luck with it.
Thank you.
I know you mentioned Reach Far. What exactly is Reach Far? Because I've heard this before, but I'm not, I want our viewers to know that how elaborate is this program? So I'll have you tell me, what is this?
Sure. So REACH FAR stands for Racial and Ethnic Approaches to Community Health for Asian Americans.
Okay.
And it was a program that was funded by the Centers for Disease Control and Prevention, the CDC, based in Atlanta. And the funding was really given to us to create a program to do two things in Asian American communities. One is to increase access to care to improve the cardiovascular health in our communities, and the other is to increase access to healthy foods and beverages in our communities. And really the philosophy behind REACH FAR is to reach the community where they are and to bring the message of health promotion to them. If you think about New York City, we live in a city that has some great health programs at the population level. There's a lot of programs and policies that are being geared towards improving communities' health. But those programs don't always filter down to our population. Sometimes the messages aren't translated into the languages that our communities speak, into Punjabi, into so many other languages, or they're done in a way that's not relevant to us. There's health advice given around diet and nutrition that's just not relevant to our communities. So our program is really geared towards making sure programs, policies, and messages are disseminated to communities in ways that are meaningful to them.
And how long ago did this program start?
It was started in September of 2014.
Oh, wow. It's a fairly new program then.
It is a fairly new program, but it's really based on a long history of work that NYU, as well as our community partners such as United Sikhs, have been doing for many, many years, several decades in the New York City area, bringing health programming to these communities.
So you know what, Rucha, when did you guys get involved with REACH FAR?
We've been actually involved with REACH FAR since the inception. We are one of the 4 community partners, and our work focuses on working with the Sikh American community in Queens and in Carteret, New Jersey.
Okay. And you've been involved with it since its inception.
Yes, I have.
How do you feel this program has helped the community?
I think one of the program is divided into different components. So one of the components, for example, is a hypertension monitoring program called Keep on Track, which is supported by the New York City Department of Health and Mental Hygiene. And under the Keep on Track part of REACH FAR, we were able to train volunteers, community volunteers, so really members of the Sangat, to get trained on how to conduct hypertension, blood pressure screenings. So they were trained by the Department of Health, and they go back to their communities and they conduct monthly free screenings for community members to come and get their blood pressure checked. Of course, none of us are clinical providers, so we're not doctors, we're volunteers, but they really are able to make sure that community members are taking a look at their blood pressure on a monthly level. And if they see something that doesn't quite look right, we definitely encourage our Sangat members to talk to their doctors, to talk to their providers more about it. And also, sometimes, depending on the situation, we're also able to give them specific questions to ask their doctors, or they're able to take the blood pressure readings and take it to them so there's some sort of a record of all the times that they have come. We're able to provide those. And so really, the community has been engaged, also as volunteers, but also within the program on a monthly basis. In addition, we're also working with Gurdwara leadership to see if we can add healthier options for langar, so that we're able to get more fruits, more vegetables, get low-fat dairy included. And it's not a perfect process, but the response that we've gotten so far has been very, very amazing.
Really?
Yes.
Good. To get away from all that heavy cream and the matar paneer and all of that, really?
I think as we've done the work, everybody sort of agrees that Gurdwara provides, langar provides many comforts and benefits of home in a way that few other things do. I think we're not taking anything away from anyone. So those of us who enjoy that are welcome to enjoy that. But a lot of our community members do have high blood pressure.
Yes, they
They're
do.
watching their fats, they're watching their sugars. And if we go back to the basic concept of langar, it has to be accessible to everybody.
Yes.
And a lot of times we don't think as much about those of our Sangat members who would not maybe, who would like to have a healthier option. So it's not to take anything away, but maybe adding a salad, maybe adding some fruit. That makes a huge difference for those of our Sangat members who don't, who want to be healthy and still come to Gurdwara and enjoy langar.
You know, something you mentioned, you said that the volunteers that partner up with you, they're not medical professionals. But how do they get the training to know that the readings that they're doing are accurate, or the programs that they're doing, the information that they're collecting and passing it over for research purposes also is accurate? How do they get the training for that?
The New York City Department of Health and Mental Hygiene actually trains
Okay,
our volunteers.
okay,
And they are given certain parameters in which to function.
okay.
If it goes beyond those parameters, then definitely it's handed over to a provider.
Okay.
And if a Sangat member needs help looking for a provider, we can definitely help them do that.
Okay.
We're working with some providers as part of Reach Far to spread the message of hypertension awareness. So it really is it's individual based. The point is for the community members who are coming to get screened to be aware of what their numbers are.
Okay.
So it's all about knowing your numbers
Okay.
and making sure that we continue to monitor that on a regular basis.
So, you know, I have to ask this to both of you then. Is this available for people who don't speak English? Because I know a lot of paperwork, if they have to take anything back home with them and stuff like that, is it only in English or is it in different languages that people, it can be facilitated in such a way that it makes it easy for them? Is that available?
Absolutely, and that's really the whole sort of philosophy and mission behind our program, is to bring resources to communities in the languages that they speak, in the places that they are. So
Okay.
where are our communities? They're in the gurdwaras, they're in the Indian grocery stores, they're at the Indian restaurants. So we're really working with all of those different institutions and providing health education materials, marketing materials that are in Punjabi, and that are also designed so that they are visually appealing to our communities. Just going back to something Rucha said, you know, I think part of our message is that you don't have to give up the traditional food that you love. There are actually ways to make our food healthy, you know, to eat whole wheat rotis, to include some of the amazing variety of fruits and vegetables that South Asians eat, you know, including more of those into your diet. And so all of that imagery has been incorporated into the materials that we're disseminating, so that it also really is fostering a sense of cultural pride from our communities, and that, you know, at the same time really promoting health.
Well, you know what? It sounds delicious, of course.
Yes.
When you're thinking about eating, you know, fruits and vegetables and stuff like that, I'm a big eater. I enjoy those things.
Right.
So yes, I do wish that, you know, they would make these changes in our gurdwaras, but we can only be hopeful. We're going to take a short break, and we're going to come back, and we want to know more about how this program really works and how people can take benefits from it. So please stay tuned. We'll be right back after this quick break. Welcome back to our show. Today we're talking about Hypertension Awareness Day. Reach Far is the program which, of course, these wonderful ladies have been telling us about what exactly it is and how it's been helping the South Asian community. So you know what, there's one thing I think people want to know that I would think that come to their mind is when they're coming for these screenings to the gurdwaras or local centers where these things are set up, do they have to pay for this? Do they have to have medical insurance or something in order to get these screenings done? Or is it open to anyone and everyone?
So the program is open to everyone.
Okay.
There is no need to have insurance.
Oh, okay.
If you don't have insurance, however, you are welcome to speak to us, and we have resources that might be helpful.
Okay.
The program is free for everyone. The monthly screenings are free, and participation in any of our projects that are working, especially the health projects, is free for the
Wow.
community members.
So then how does this program get funded? Who's funding the program?
So this program is funded by the Centers for Disease Control and Prevention, the CDC.
Okay.
And the reason they funded this program is really to provide a venue to disseminate these programs and policies to communities that aren't getting them. You know, we know that our communities are sometimes underserved and left out. And so the CDC is really investing in this project to make sure that there are ways to decrease health disparities in our communities.
Oh, wow. So you know what? Because I know that would be a big concern for people, that what if I don't have insurance? I can't do this. Because maybe that's one of the reasons people don't go to their doctors, is because they might not have insurance. So that's another issue, different issue altogether. But you've been doing this now for almost 2 years. People have been coming back, like you said, you have monthly screenings being done and annual screenings being done. Do you see a change in the program since when you started to where it is today? Do you see an increase in the places that you've been going to where people are becoming more conscious of their own health? Do you see that? Or is it still the laid-back attitude that, all right, nothing's wrong, so I don't need to go to a doctor?
I think people's attitudes are individual, but one of the things we've definitely seen is that having the community members, the Sangat members themselves be volunteers, means that they're at the Gurdwara, other people see them all the time, they may already know them because they're part of the Sangat, and that really encourages a dialogue. They're not as intimidated to ask questions. Of course, we don't know all the answers, but it's definitely, we've been seeing gradually over the course of Reach Far that people are, we have more people coming for screenings. Every month when we have screenings, we have new people that come. And also there is this wonderful word of mouth that goes in the Gurdwara. So if I'm going, I may tag a friend along. And so that is really, we've been seeing more and more of that. So the programs have definitely been growing, and we're hoping for them to grow much more as we move forward.
But is this only, these programs, are they only in the Gurdwaras, or are they also available in like mosques or temples or other places like that? Is it, you know, in certain areas that one has to go to, or is it, you know, what are the other places that people can go to?
So we're working across 4 different communities. We're working in the Sikh community, but also the Bangladeshi community, the Korean community, and the Filipino community. And we're using very similar strategies, working across mosques, across churches, but also across ethnic grocery stores, ethnic restaurants, and also our small primary care providers. We know that people from our communities really like to go to doctors who are from their own community, who speak their language. And so we're working with pharmacists, we're working with nurses, we're working with other health professionals who are serving the patient population that we're working with. And I think I'll just add to Rucha's comment that, you know, change really happens at the community level.
Yeah.
And so it's not just about, you know, individuals changing their behavior, but that's why also we're working with the Gurdwaras to try to change langar. It's why we're trying to promote healthy options at some of the restaurants we eat at, to make sure at the grocery stores healthy items are being featured and promoted. And so, you know, it's really kind of thinking about environmental change, community level change, as well as individual level change.
Okay, you know, talking about changes, I know I have to bring this to you, Rucha. United Sikhs has been at the forefront of bringing changes for a lot of different things in positive way for our community. And you know, not just, you know, in the health aspect of this one, but even in social awareness and other matters as well. So you guys have always created dialogue and gone outside the box to do things. So, which I think is great, because we need that. We really do need that. So when you, the biggest thing to change really is in a Gurdwara, when you try to tell them that, you know what, maybe we should have something different in the langar, or let's try to do things differently. What kind of a reception do you get? Because you have been to many Gurdwaras. From what I was reading up earlier, you have done quite a few Gurdwaras by now where you've taken this program to.
Right. And I think a big part of working with Gurdwaras is really involving the leadership. And so even before Reach Far, when we work with Gurdwaras, we really want to know what the local Sangat thinks, and what the local Sangat is, what changes they're willing to do, what changes are not acceptable, because we don't, with langar especially, we don't want to offend anybody.
Of course.
And we don't want to take anything away. And I think that the leadership has been very supportive of adding healthier options, because that also contributes to healthy environments in the Gurdwara, and that their Sangat members are healthy. So I think the conversation has to be both ways. So it's not so much us going and saying we want to change all of this, but us going and saying we want to make some changes so our Sangat is healthier. Here are some ideas. What do you think will work? What do you think will not work? And really having that open dialogue with the leadership and other Sangat members, the main Sevadars at the Gurdwara, really having that open relationship with them where we say, look, it's really important. At a Gurdwara, we have these some very unique opportunities that not all community members have. We pray together, we eat together, we study together, our kids are watching us.
Yes.
So there are these amazing opportunities to make positive changes that would be very fruitful. And having that conversation, in my experience, has always been very, very positive, especially when we start having this two-way dialogue with the local Sangat. Because no two Gurdwaras are the same.
Absolutely not. My gosh, we know that. We definitely know that one. It's dealing with two, like, north and south sometimes.
Right.
But you know what? At least I'm glad to hear that they're receptive on this and they're open to the idea that, okay, change is needed. But another thing I also wanted to know is, how do you get people, how do people find out about this? How is one to find out that this is happening at my local Gurdwara this weekend or next month? So at least, they can be prepared to come and get their screenings done. And let me ask you, what kinds of screenings are being done when you guys go for these medical camps?
So in terms of how to find out about it, we've created a series of posters and other types of materials, including health education materials, that we're putting up at Gurdwaras, we're putting up around the community. Each of our organizations has websites, and the material is up on the websites. And we're really trying to build a coalition here with this project. And so I would say, if there are other Gurdwaras, other restaurants, grocery stores, healthcare providers that are interested in kind of helping to prevent hypertension in the Sikh community, they should reach out to us, because I think the broader that we could disseminate these programs and strategies, the better it is for all of us.
Okay, so but here's my question though. How does one find out, like, if they are, if they're not, someone's busy, okay, like an average person is going in and out to the city every day, and they don't get a chance to go for their grocery shoppings till the weekend, or someone in the family is doing it for them, or they don't get to go to Gurdwara every single day. How else are they going to find out, like, where else can they go? Like, what websites do they go to get this information? Like, is United Sikhs passing out this information, or is your organization passing it out? How do people get involved to find out about it?
So because our Sangat gets information from a variety of sources, we're trying to promote information in a variety of different ways. So we're hoping one of the ways people will find out is through this program.
We hope so.
and that they should feel free to get in touch with us for any more further information that they may need on Reach Far, or if they want to get involved, or that that the program is not in their Gurdwaras yet, because, like you said, it's a new program. We're still spreading and expanding, but they want to start something. They want to. We have the materials. We definitely can start spreading that message even outside of the Gurdwaras where this is currently taking place. We also use our social media platforms quite a bit. So, for example, for World Hypertension Day, there's been a series of messages on the United Sikhs Facebook page. We try to send out information on our listserv. We also try to talk, to be at Gurdwara and talk. So we try to cover as many places as we can, as many points of information that we can, that we know our community members get information from.
Okay, so what websites can people go to? If you want to give me specific websites that we can share with our audiences, where can they go to get this information? Your website information, or your website information, where people can go and find out, okay, or they can interact with you there to get more information, to find out if it's happening at their local Gurdwara. Or they might want the camp to happen at their Gurdwara if it hasn't happened already.
Absolutely. So they can visit our website, www.unitedsikhs.org, and there's information on the website.
Okay.
If they would like to get in touch with us directly, They can reach us at CEED-USA, that's CEED-USA at unitedsikhs.org.
Okay.
Or they can also call our office at 718-441-6644.
Okay, perfect. And I know we're almost out of time, but we want to thank you so much for the valuable information that you've shared with people. And of course, as your events keep happening, keep us posted as well, so we can always share it with our viewers and audiences so they can go and start these preventative measures, if they may, please. Rather than partying, I would rather, they go and they make this a priority in their life. But I want to thank you, ladies, for being here today and for sharing this information with our viewers.
Thank you so much.
Thank you. It was our pleasure.
So, Uzain Ali, we want to thank you all for watching our show today. And please do make your medical visits, your medical health a priority for yourself. We have a lot of people in our community that suffer from a lot of different ailments, but they just don't know how to go about to get help. Language barrier, be it insurance. But you know what? These are all things that we put in front of ourselves to say, I can't because of this reason. Sometimes that might not really be a reason, because there might be a way around it. Like Rucha and Dr. Islam just told us, these are free camps offered to you, free screenings offered to you. So do take, the help from this and make it better for yourself. You can visit their website at www.unitedsikhs.org and find out more information about it. With that, I want to thank you all for watching our show. Thank you and good night.